Hi, my name is Muhammad SYAZRIL bin AMIR, metric number 291253. So today, our group will be talk about obsessive-compulsive personality disorder, also called OCPD. So according to Dr. Timothy J. Leck, which is a licensed psychiatrist and also professional counselor, an excessive demand for order, perfectionism, and mental and interpersonal control is a definition of OCPD. So people with OCPD have a moral and ethical code from which they will not stray, as well as an obsessional drive to adhere to laws and regulation in a way feels they are always correct. So also, according to the 5th Diagnostic and Statistical Manual of Mental Disorders, which is DSM-5, people with OCPD does not recognize that their impulses are irrelevant. Meanwhile, people with obsessive compulsive disorder, which is OCD, does aware of it. Alright, there are 8 diagnostic criteria or symptoms that can be referred based on Diagnostic and Statistical Manual of Mental Disorders, which is 5th edition of DSM, which is DSM-5. It is to verify and diagnose the patterns or behavior of someone with OCPD. So all the criteria have been stated in the screen. So according to professionals, if someone with OCPD have at least 4 out of 8 criteria in the DSM-5, it can be diagnosed as OCPD patient. And also, there are debates and still ongoing discussion about the specific causes of OCPD, which is obsessive compulsive personality disorder. But genetics factor and also childhood trauma can be the variables to the development of OCPD behavior and also patterns. It also seems as others mental health and also personality disorder.
Assalamualaikum warahmatullahi wabarakatuh. My name is QISTINA with metric number 2912. So I'll be talking about OCPD, the differences and comparison between OCPD and NPD. So these two terms are two separate personality disorders, but they express some similarities in terms of their impact on individuals' behavior and functioning. Both disorders involve certain personality traits and thinking patterns that significantly influence how individuals interact with others and navigate their daily life. However, it's important to emphasize that OCPD and NPD are distinct disorders with their own specific criteria and underlying motivation. They are myriad of differences between OCPD and NPD. First and foremost, OCPD is defined by an enduring pattern of excessive focus on orderliness, perfection, and control. Individuals with OCPD exhibit a strong compulsion for tasks to be executed in specific ways, often fixating on rules, details, and organization. Their thinking has to be inflexible, and they establish high standards for themselves and others. In contrast, NPD, narcissistic personality disorder, is characterized by an inflated self-importance and a perpetual craving for admiration. They exhibit a lack of empathy and employ manipulation or exploitation to fulfill their personal desires. On top of that, the primary focus of individuals with OCPD is on maintaining order, perfection, and control in their lives and surroundings. They have an intense need for things to be done in a right way according to their own standards. They may become excessively focused on rules, regulation, and maintaining precise order in their environment. On the contrary, NPD are primarily concerned with people with NPD are primarily concerned with gaining admiration and superiority over others. They have an insatiable need for attention and validation. They may engage in self-enhancement strategies such as exaggerating their achievements or challenges to maintain their inflated self-image. Furthermore, individuals with OCPD often struggle with interpersonal relationships due to their perfectionism and need for control. They may have difficulties delegating tasks to others because they believe only they can do their work correctly. They may also struggle with expressing emotions and may appear emotionally distant or overly focused on tasks and roles. While people with NPD often have difficulties maintaining healthy relationships due to their self-centeredness and lack of empathy. They may exploit or manipulate their partners for personal gain and have a sense of entitlement in their relationship. Last but not least, individuals diagnosed with OCPD are driven by an intrinsic motivation to uphold their own standards and exert control over their surroundings. They often possess a strong work ethic and perceive themselves as responsible, diligent, and meticulous individuals. NPD are primarily motivated by an intense craving for admiration, validation, and recognition from others. They have an inflated self-image, perceiving themselves as unique and superior in comparison to others. So consequently, they develop a sense of entitlement, expecting special treatment, privileges, and acknowledgement. Thank you.
Hi, I am RAUDHATUL metric number 291224. So now let's move on to the next part, which is the difference between OCPD and DID. The first component that we are going to look is characteristic. Person who suffer OCPD has obsession with organizations, control, and also perfectionism. When they do something, they really want the things to be perfect. Even the smallest imperfect thing occurs, it will affect them. However, the characteristic of DID is feeling discontinuity and separation from one's thought. You know how to recognize DID person? Have you ever seen at social media about the person who has split personality? Yes, it is DID to make it short. So for the next component is factors that lead to these two types of mental disorders. The factors that lead to OCPD is from genetics, where they found a defective gene, while for DID, it has came from trauma. For example, there's a boy who always being bullied, then the fear in his mind has created one new personality to the boy which can protect the boy who was being bullied. And the new personality that has been created, it can be braver than the one personality who are always being bullied. The last component that we are going to look is treatment. From the research, I found out that there are similarities treatment that can be used for these two disorders, which is psychotherapy talk. And then let's look at the difference for this treatment. For OCPD, we can use psychodynamic therapy, which focuses on the psychological causes, emotional pain, and cognitive behavioral therapy, which known as CBT. While for DID is psychosocial therapy, which entails talking with mental health experts about your conditions and related issues.
My name is ASLAM. My metric number 288817. Next, we move to the application of personality theory. So basically, the personality theory related to this personality disorder is the theory from Eric Erikson, which is psychosocial development. This is because, according to Indira, stating that this OCPD is caused by the factor of past experience. This factor is indeed very closely related to the theory of psychosocial development, where in that theory there is a statement about the level of psychosocial level, which is described the psychosocial nature of human themselves. Based on that factors, the most accurate level to describe it is at the level of identification versus identity diffusion, which is in stage 5. At this stage, it happens during adolescence, and that is also when a person starts to question and doubt about himself. At this level, also a person starts to be close to his friend and start thinking about the future. Exploration is likely to occur at this stage. They will begin to recognize their identity based on their life experience, and this will cause them to feel confused about their own identity at this time. As a result of the influence, observation, way of life during adolescence cause them to have this OCPD disease. It is closely related to a person's past experience. Overall, it can be said that OCPD is closely related to the psychodynamic theory, which is the theory of psychosocial development. This is because OCPD disease is closely related to the factors of the past and also the level of pleasure and stress of the individual. Those factors are also closely related to the stage of development of a human being. In those stage, a person will create their own personality, whether it is good or bad, depending on various factors, including the environment, parental education, way of thinking, resilience, and so on.
Assalamualaikum to Dr. Sanwa Anwar LASHARI and to all my friends. My name is Khairul Anwar SHAHRIL. My metric number is 289742. My student number is 26. For my part, I will present about the cure and treatment for OCPD, which is the psychodynamic and psychotherapy, which refers to a variety of treatments such as cognitive behavior therapy, also known as CBT, founded on psychoanalytic theories and techniques. The sessions are usually held once or twice a week and can be also either time limited or indefinite. A good treatment is exposure and response prevention, also known as ERP, which is a type of cognitive behavioral therapy, CBT. During the therapy, patients are shown scary scenes or images that remind them of their cravings. The goal of reaction prevention is to get people to stop doing the capacitating things that they usually do. The patient learns that his or her nervous thoughts are just thoughts by staying in a situation that makes them afraid and nothing bad happen at all. Thank you.
Dialectical behavior therapy is based on cognitive behavior therapy, CBT. However, dialectic behavior therapy, DBT, differ by placing greater emphasis on acceptance and transformation, leading to superior outcomes in the treatment of personality disorder. It has been discovered that a particular kind of DBT, known as radically open DBT, which is RODBT, is a transdiagnostic treatment that targets a few difficult to treat disorders that share phenotypic and genotypic traits linked to maladaptive over-control disorder, such as obsessive-compulsive personality, anorexia nervosa, and chronic depression. The RODBT method encourages social signaling or expressing one actual feeling in order to improve relationship, flexibility in ideas and behavior, openness, and a good interpersonal interaction. RODBT usually involves 30 individual and group sessions per week. According to RODBT, the development of a strong social ties is correlated with emotion communication function. Aside from that, medication can also be used as a standalone treatment or in conjunction with psychotherapy. Doctors usually prescribe selective serotonin reuptake inhibitor, SSRI, because they can assist people with OCPD to become less rigid and some obsession with rules and order. Personality disorder are linked to neurochemical abnormalities. Psychopharmacotherapy is often used to treat personality disorder because it has the ability to rectify imbalance or deficiency in a certain neurotransmitter system, thereby returning the central nervous system of those with personality disorder to a more normal neurochemical state.
Alright, moving on to the last part of the presentation. OCPD or Obsessive Compulsive Personality Disorder can negatively affect a person's relationships and also day-to-day functioning. And also, OCPD is frequently linked to perfectionism. So, obsession with perfection may cause them to pay too much attention to inconsequential details, which could hinder their ability to finish projects quickly. And also, in conclusion, OCPD is a complicated personality disorder that can have a serious effect on person's quality of life. People with OCPD can learn to control their symptoms, develop better social skills, and also lead more rewarding lives with the right care and support. And also, society need to have the awareness of personality disorders so they can categorize themselves and also live a better life. That's all from us. Thank you.